They rely upon studies that are done overseas. So when Meningococcal and all other vaccines were approved in Australia, they were approved based on information that was provided overseas. Well, you might think, okay, well, that's fine. Overseas, they've done the studies, they've done the tests, they've shown these things to be safe and effective. But when you look at the studies that have been done, almost all of them were funded in part or in whole by the manufacturers of the vaccines themselves. That's as if we said, okay, the government doesn't have enough money to test cars any longer, so Holden, you go out there and test the cars, and you come back and tell us if they're safe, if they will, survive a crash, and if people will not be hurt in them. Holden goes out, Holden has a product to sell, so they come back and say, yep, our cars are safe, and the government says, okay, Holden says they're safe, they must be safe. This is exactly the same thing. Pharmaceutical companies are companies. They are multinational corporations who answer first to their shareholders. They are not concerned with the safety of vaccines unless they're made to be concerned with the safety of vaccines. And the approval process in Australia does not make them concerned about the safety of vaccines. So we don't have a process here whereby we can be assured that the vaccines we're using on our children and on ourselves, because a lot of these vaccines are being targeted at adults, meningococcal is one of them, we don't have a process to be sure that these vaccines are safe. Our government is not doing their job, and our medical community in general doesn't know any more than the pharmaceutical companies think to tell them. There was a survey done by the Australian Doctor Weekly, which is a medical paper targeted at GPs, and they found that 89% of the information that the average GP gets is given to them by pharmaceutical company salesmen. So the people that we go to for advice on what to do with our children and with our families may not know any more about this issue than we do. And if we've done a little bit of reading, chances are we know a great deal more. Now, one other thing I'd like to talk about with meningococcal and the vaccine that we're using is the types. There are different strains of meningococcal bacteria. The most common cause of meningococcal infections in Australia is caused by a group C meningococcal bacteria. The government says 75%, but I actually spoke with Dr. Bartlett, who's the head of our public health unit up in northern New South Wales, where I'm from. And he said that it's 90% in northern New South Wales being caused by meningococcal B. The problem is there is no meningococcal B vaccine. So the government, in its wisdom, has chosen to license and use meningococcal C vaccine. Now, meningococcal C will not prevent infection by meningococcal B bacteria. So by vaccinating people with meningococcal C, we are doing nothing to get rid of between 75 and 90% of the meningococcal infections, even if the vaccine were effective. So $41 million, our dollars, my dollars, and your dollars, is being spent on this vaccine that's not even the right vaccine for Australia. I don't know why. It would be really good to know why. But this vaccine, like I said, even if it was effective against meningococcal C, would do very little to prevent the cases of meningococcal infection that happen in Australia. Now, let's look at meningococcal and find out who will be susceptible. According to the government, the people who are the most susceptible to meningococcal or to all cases of bacterial meningitis are people who are intravenous drug users, people taking immune suppressive therapies, like people who are on cancer treatments or taking steroids. That may include some asthmatics. These are the people who are at risk because, again, like I said, meningococcal bacteria and all of these bacteria that can cause meningitis are everywhere. They're in all of us, but we're not sick with it. You have to have an immune system that's suppressed in some way in order to get the disease, meningococcal or septicemia. So how can we prevent infection? Now, I'm not a doctor, I'm not a medical professional, but I do know from what I've read and from the research that I've done that a strong and healthy immune system is one of the best ways to prevent any kind of infection and to stay healthy. Health is not necessarily being vaccinated. Health is high vitality. Health is lack of disease. So if we take care with our own immune systems, keep them strong, make sure they're supported, then meningococcal and all of these other diseases should not be a problem. And we see that when we look back at the history in Australia. When we look back, we see that these infections, these bacterial meningitis invasive infections, have increased exponentially since the vaccines were introduced, not the meningitis vaccines, since vaccinations were introduced and started to be used on a mass level. And why is that? Because vaccination by its very nature can suppress the immune system. Our immune systems are not made to take cocktails of toxic chemicals, which many vaccines contain. They're not made to take 5 or 6 viruses and bacteria at one time. If we catch measles, we catch measles. We don't catch measles, mumps, and rubella. We don't catch diphtheria, whooping cough, and tetanus. We catch measles. So we need to support our immune system, and we need to do things that don't suppress the immune system. We need to look at vaccination from many different angles, and we need to look at our health from many different angles. And we need to figure out what's best for our own families. What many of you need to know, and if you don't already know it, it's very, very important. Vaccination is not compulsory in Australia. Your children can still go to school. Maureen Hickman's going to be speaking about this later on. But vaccination is not compulsory. You have the right to look at this issue and to make your own decision. And there is a lot of information out there, even though your doctor may not be giving it to you. We do have a lot of information, and you have the right to access that. Valid questions are being asked. Vaccination, like all medical procedures, is a science. And science is asking questions. Science is testing and looking at results. And right now, we are not looking at the results, and we are not asking the questions. When it comes to things like meningitis, fear is not a good place to come from. And when it comes to any health issue, fear is not a good place to come from. And you will find that when you have the information to back up your decision, when you feel secure because you've been informed, you will be able to make the right choice for your own family. Whether that choice is to vaccinate or not vaccinate, if you get the information first, before you make the decision, it will be the right choice for your family. Thank you.